The universe is vast and full of mysteries. We explore the cosmos, seeking answers to profound questions. Yet the most pressing challenges arise from a microscopic world here on Earth. COVID-19 has swept across our planet, reshaping our daily routines. Understanding this virus is a shared responsibility. Knowledge is our most potent tool. We must arm ourselves with accurate information about COVID-19. Simple preventive measures can shield our communities. We are active participants in a global effort to mitigate the spread of COVID-19. Imagine a microscopic sphere, studded with spike-like proteins, resembling a miniature crown. This is the coronavirus, named for its crown-like appearance. Coronaviruses can cause mild illnesses like the common cold or severe diseases like COVID-19. COVID-19 emerged in late 2019, targeting the respiratory system. Its impact extends beyond health, disrupting economies and daily life. COVID-19 spreads primarily through respiratory droplets, tiny particles of saliva or mucus expelled from the nose or mouth of an infected person when they cough, sneeze, talk, or even breathe. These droplets, laden with the virus, can travel up to 6 feet, potentially infecting others nearby. Imagine a sneeze, a forceful expulsion of air, carrying with it a cloud of invisible droplets. Some droplets may land directly on the noses or mouths of people nearby. Others might be inhaled, finding their way into the respiratory systems of unsuspecting individuals. These droplets can also settle on surfaces, from doorknobs and countertops to elevator buttons and shopping carts. The virus can survive on these surfaces for hours or even days depending on the material and environmental conditions. Touching a contaminated surface and then touching your face, particularly your nose, mouth, or eyes, provides another entry point for the virus. This mode of transmission highlights the crucial role of personal hygiene and social distancing in curbing the spread of COVID-19. By understanding how the virus travels, we can adopt practices that minimize our risk of exposure and protect ourselves and others. Once inside the body, the COVID-19 virus begins its invasion, targeting cells in the respiratory system. The virus's spike-like proteins latch onto receptors on the surface of healthy cells, particularly those lining the airways and lungs. Think of these receptors as doorways into our cells. The virus's spike protein acts as a key, unlocking these doorways and allowing the virus to enter and hijack the cell's machinery. Once inside, the virus replicates, creating copies of itself, which then burst out, infecting more cells. In mild cases, the immune system mounts a defense, battling the virus and limiting its spread. The body experiences symptoms like fever, cough, and fatigue as it fights off the infection. However, in more severe cases, the virus can overwhelm the immune system, leading to pneumonia, acute respiratory distress syndrome, ARDS, and other life-threatening complications. Understanding how the virus replicates and interacts with our immune system is crucial for developing effective treatments and vaccines. It also underscores the importance of supporting our immune systems through healthy lifestyle choices. Section 5. Recognizing the signs from mild to severe. COVID-19 manifests in a variety of ways, with symptoms ranging from mild to severe. Some people may experience only mild symptoms, like a mild cough or low-grade fever, while others may develop more serious illness requiring hospitalization. Common symptoms include fever, dry cough, fatigue, muscle or body aches, headache, sore throat, congestion or runny nose, new loss of taste or smell, nausea, vomiting, and diarrhea. These symptoms typically appear 2 to 14 days after exposure to the virus. It's important to remember that not everyone infected with COVID-19 will experience all of these symptoms. Some people may be asymptomatic, meaning they carry the virus but show no signs of illness. This makes it even more crucial to practice preventive measures, as we could be spreading the virus unknowingly. If you experience any of these symptoms, it's essential to isolate yourself from others and contact your healthcare provider. Early detection and management of COVID-19 are crucial for improving outcomes and preventing complications. Section 6. Vulnerability on the line. Who's most at risk? While COVID-19 can infect anyone, certain individuals are at higher risk of developing severe illness. Older adults, particularly those over the age of 65, are more vulnerable to complications. As we age, our immune systems naturally weaken, making it more challenging to fight off infections. People with underlying medical conditions, such as heart disease, lung disease, diabetes, obesity, or compromised immune systems, are also at increased risk. These conditions can compromise the body's ability to fight off the virus, leading to more severe outcomes. It's crucial for these high-risk individuals to take extra precautions to protect themselves from infection. This includes strict adherence to preventive measures like hand hygiene, social distancing, and wearing masks in public. Vaccination is also particularly important for these groups to reduce the risk of severe illness. We must all do our part to protect the most vulnerable members of our communities. By understanding who is most at risk, we can make informed choices that minimize their exposure to the virus. Section 7. Building our defenses. Strategies for prevention. Prevention remains our most potent weapon against COVID-19. Hand hygiene is paramount. Wash hands frequently with soap and water for at least 20 seconds. If soap and water aren't available, use an alcohol-based hand sanitizer. Avoid touching your face, especially your eyes, nose, and mouth. Maintain a distance of at least 6 feet from others in public settings. Wearing a mask in public provides an additional layer of protection. Vaccination is crucial in our fight against COVID-19. Section 8. Emergency alert. When to seek immediate help. While many people with COVID-19 experience mild symptoms, some develop severe illness requiring immediate medical attention. Recognizing these emergency warning signs is crucial for prompt intervention and potentially life-saving treatment. Shortness of breath or difficulty breathing is a red flag. This indicates that the virus may be affecting the lungs, leading to pneumonia or other serious respiratory complications. Persistent pain or pressure in the chest can signal a heart attack or other cardiac event, potentially triggered by the virus's impact on the cardiovascular system. New confusion or inability to arouse can indicate a neurological complication or a sign that the body is not receiving enough oxygen. Bluish lips or face signal cyanosis, a condition caused by low blood oxygen levels, requiring immediate medical attention. If you experience any of these emergency warning signs, call 911 or your local emergency number immediately. Early intervention is crucial for improving outcomes in severe cases of COVID-19. Section 9. Staying informed, staying safe. Key takeaways. COVID-19, a novel coronavirus, has presented unprecedented challenges to our world. Understanding this virus, its modes of transmission, and the measures we can take to protect ourselves is crucial for navigating this new reality. We've explored the virus's structure, its journey through the body, and the range of symptoms it can cause. We've also discussed who is most at risk of developing severe illness and the importance of protecting these vulnerable populations. Prevention remains our most potent weapon against COVID-19. Hand hygiene, social distancing, wearing masks, and vaccination are crucial measures we can all take to reduce our risk of infection and protect our communities. Recognizing emergency warning signs and seeking prompt medical attention are vital for improving outcomes in severe cases. By staying informed, staying vigilant, and adhering to preventive measures, we can navigate this pandemic and emerge stronger, together. Section 10. Navigating the new normal, adapting and thriving. The COVID-19 pandemic has ushered in a new normal, requiring us to adapt our behaviors and lifestyles. We must prioritize our well-being, adopting healthy habits like regular exercise, a balanced diet, and adequate sleep to strengthen our immune systems. Social connections are essential for our emotional and mental well-being, but we must find new ways to connect while maintaining physical distance. This new normal also demands flexibility and resilience. Section 11. A final word, our collective health, our shared future. As we navigate the complexities of the COVID-19 pandemic, one thing remains clear: our health is interconnected. The choices we make as individuals ripple outward, impacting our families, communities, and the world at large. Just as the stars in a galaxy are bound by gravity, our destinies are intertwined. By embracing a sense of shared responsibility and prioritizing the well-being of ourselves and others, we can create a healthier, more resilient future for all. The challenges posed by COVID-19 are significant, but they are not insurmountable. By harnessing the power of knowledge, embracing scientific advancements, and prioritizing preventive measures, we can navigate this pandemic and emerge stronger together. Let us remember that even in the face of adversity, the human spirit of innovation, compassion, and resilience shines through. By supporting one another, sharing accurate information, and adhering to public health guidance, we can create a future where health, well-being, and a shared sense of purpose prevail.